Today, I want to talk to you about creating a primary care-based disease management program for persons with multiple chronic conditions. Older patients with multiple chronic health conditions and complex healthcare needs often receive care that is fragmented, incomplete, inefficient, and ineffective. Evidence-based guidelines geared to single diseases are insufficient to effectively address the constellations of conditions seen in patients with multiple chronic conditions. One of the biggest challenges facing primary care is identifying a practice-based cohort of patients for whom chronic disease management interventions would be successful. Here are some sobering statistics about the concentration of healthcare. In a recent Commonwealth Fund issue brief, Hong, Abrams, and Ferris concluded that primary care integrated complex care management programs perform four essential activities. They identify and engage patients who are at high risk for poor outcomes and unnecessary utilization. They perform a comprehensive health assessment to identify problems that, if addressed through effective interventions, will improve care and reduce the need for expensive services. They work closely with patients and their caregivers, as well as primary care, specialty care, behavioral health care, and social service providers. They rapidly and effectively respond to changes in patients' conditions to avoid use of unnecessary services, particularly emergency department visits or hospitalizations. Let's look at the larger context, the patient-centered medical home. This is a model of care delivery in which a primary care clinician and members of the care team coordinate all of a patient's health needs, including management of chronic medical and behavioral conditions, visits to specialists, hospital admissions, and reminding patients when they need checkups and tests. Here is a graphic of the patient-centered medical home model with each level building on the one below it. We see that care coordination and clinical care management are on the top floor of the PCMH. This requires that the supporting infrastructure be in place to support this advanced level of care. Does clinical care management work? Clinical care management is a nearly universal element of the strategies used by providers accepting financial risk under Medicare's Accountable Care Organization contracts. Why is care management important? Care management can change a passive health system that waits for the client or patient to be involved into an active and engaging health system based on outreach. We can see that clinical care management can have impact across many domains. Who are the patients who would most benefit from care management? One goal is to identify patients and their risk drivers through systematic assessment. Then we can develop a multidisciplinary care plan that includes input from the patient and other members of the care team, behavioral health, nutrition, clinical pharmacy, among others. A care plan can be developed that addresses the risk drivers through development of patient-centered treatment goals. Interventions directed at achievement of these goals are co-created and integrate the patient's values and preferences for care. Identifying the highest risk patients is the first step on the clinical care management continuum of care. Let's learn more about these patients. The green circle represents the largest percentage of your population or panel. Many of these patients may be well. Your focus with them is on prevention and screening, consistent with evidence-based and recommended guidelines. They may appear for episodic care. The blue circle is your highest risk patient population. They're a small subset of your panel population who are most at risk for ED utilization, hospitalization, adverse outcomes, and sentinel events. Typically, these individuals are multimorbid with significant barriers to care. They cannot self-manage or appropriately engage in their own care. Together with the care team, clinical care management works with these patients on an individual basis. The goal with this population is to identify risk, manage risk, and improve outcomes with movement towards increased self-care. It's important to realize this number will never be zero. The yellow circle is rising risk. These patients are not highest risk, but may be at risk and need more than just logistical support, such as clinical monitoring and follow-up at regular intervals, and assistance in establishing self-management goals. These patients may have common chronic illnesses, but are generally well controlled. The goal is to prevent movement into the highest risk group. It's important to remember that these populations are not static. Improved status means movement away from the blue towards the yellow or green. What services might these patient populations need? Here, care coordination and care management activities are compared. Care coordination tasks in general are more logistical in nature. Along with care coordination, patients with multiple chronic conditions may need services that are listed on the right. How can we find these patients who will benefit from care management? The simplest approach may be a form of prospective risk stratification. Ask your providers and care team, who keeps you up at night? Who is on the bubble? Who do you worry about the most? Who is coming in frequently but never seems to be getting better? Other criteria to consider in defining your cohort that will receive enhanced care management services may be based on their disease status markers, patients with poorly controlled chronic conditions, A1C or PHQ-9, patients with 2 or more hospitalizations or ED visits in the past month, patients either taking a high alert medication or who are at high risk for hospital readmission, patients who are transitioning to or from home and community-based healthcare facilities for acute care services, rehabilitation services, skilled nursing services, or other community-based services. Patients who have used or use the VNA, oxygen, lack support at home, lack resources, or have financial issues. Or patients having high risk factors such as obesity, smoking, HIV, mental health, and exposure to violence. At this point in time, there will probably be a list of patients that needs to be organized in some meaningful way. Here is a patient acuity rubric that comes from the University of Kansas Health Partners. It is available in the public domain from the Safety Net Medical Home Initiative website, www.safetynetmedicalhome.org. It is an Excel spreadsheet that will calculate a total acuity score for each patient, 0, 1, or 2 across 7 domains, giving both a total risk score and a domain-specific risk subscore. The domains are social, language, health literacy, self-management, mental health, chronic illness, and chronic meds. This can help identify the most significant area or areas of need for a particular patient that will become the basis for developing effective and actionable interventions. Once the patient risk is evaluated, a care plan must be developed and implemented. This algorithm is from a recent article in the New England Journal of Medicine by Aronson, Bautista, and Kovinsky titled Medicare and Care Coordination, Expanding the Clinician's Toolbox. While designed to respond to Medicare's Chronic Care Management Reimbursement Program, it displays what a stepwise approach to developing a patient-centered care plan with interventions looks like. This is used to address needs and identify and direct appropriate resources to those needs. An important part of any healthcare delivery program is performance and evaluation. Here are some clinical care management performance metrics that you may want to consider to evaluate the effectiveness of your program. This has been an overview of a population health approach to clinical care management services. Identifying patient needs in a systematic way allows assignment of valuable clinical care management resources where they will do the most good. The goal is that the approach is responsive enough to meet individual needs as well as patient population needs. Internal and external information sources can be used to identify the cohort of patients who need more active care management.